The Remote Area Health Corps, or RAHC, was established in 2008 and is funded by the Australian Government Department of Health to address persistent challenges to accessing primary healthcare services for Aboriginal and Torres Strait Islander people in the Northern Territory. RAHC is a program designed to increase the pool of urban-based health professionals available for work in Indigenous communities by attracting, recruiting and orienting them, and then providing ongoing support and training to successfully assist the health professional to make the transition to remote practice. The professions considered for a RAHC placement are general practitioners, registered nurses, dentists, dental therapists, dental assistants and audiologists. Over time, RAHC has developed a steadily increasing pool of highly motivated, effective, culturally sensitive and clinically competent health professionals who are keen to undertake regular short-term paid placements in the Northern Territory. The remote workforce in the NT is significantly strengthened through RAHC's existence, and many health centres and programs now depend on RAHC to supply their staffing needs to supplement permanent staff. It has mobilised urban-based health professionals and developed an alternative workforce for remote settings, as opposed to just redistributing it from other remote or rural settings. RAHC works closely with its stakeholders to maintain the delivery of an appropriate and responsive program. If you are a health professional considering undertaking a short-term paid placement with RAHC, you will need to make an application through our website. Once you are credentialed, you can be considered for placements as they arise. Being credentialed with RAHC is not a guarantee of a placement. You will be supported by the entire RAHC team throughout your placement journey. The Canberra-based placement team will provide you with key support in the organisation of your placement, your contract, availability, payroll inquiries and support throughout the placement if required. On the ground in the Northern Territory, the travel and logistics team will provide you with support regarding all the travel and logistical queries for your placement. The regional coordinators within the travel and logistics team are your first point of contact whilst on placement, as they provide key on-ground support and are available 24/7. On your way to your first placement, we will provide you with face-to-face cultural training in either Alice Springs or Darwin. General practitioners and registered nurses can also undertake a clinical face-to-face training day if requested. The clinical team will be your point of contact for any clinical issues you may encounter whilst on placement. They also oversee our free e-learning platform, which can be accessed through the RAHC website at any time, even if you are not undertaking a placement. The clinical team also coordinates our remote educators. The remote educators provide support to general practitioners and registered nurses on their first RAHC placement by assisting with the transition to the remote environment, both clinically and culturally. If you are ready to be part of the effort to close the gap in Indigenous health outcomes across the Northern Territory, we stand ready to support you.